right, everybody. Hello, hello. Super excited to have Dr. Michelle Retz. She has my name, so she's even more special and dear to me. And I think we spell it the same way. Yes, even better, double L's. She's here with us talking about naturopathic medicine today. I'm going to have Darcy introduce her in a second. Just want to let everybody know that we have these webinars every Monday, except for the first Monday of the month, and we have a professionals group where I'm bringing in holistic healers of all modalities and educating all of you out there to all the beautiful things that they do. I try to bring in folks that we don't typically always get educated about and highlighting the healing powers that they each have. So please join us any Monday at 9 a.m. Pacific Standard Time, 11 a.m. Central Time. And we are coming from Hirschman Clinical Services. I'm a licensed clinical social worker, Michelle Hirschman, Darcy Meehan, Director of Outreach and Coach below me. And we help folks with eating disorders, mental health, and substance abuse issues in a coaching role. So with that said, I'm going to pass the baton to Miss Darcy, and she will introduce Dr. Retz.
Thank you, Michelle. And getting ready for the two Michelles. It's like, I know this is going to be a dynamic conversation. So thank you for letting me introduce you. Dr. Michelle Retz is sharing today about naturopathic medicine and what it means to work with a naturopathic doctor. Concerned about the present state of our healthcare system, Dr. Michelle Retz dedicates herself to patient-centered care using holistic medicine that treats the cause of illness, restores vitality, and preserves health. One thing that sets Dr. Retz apart, among many things that we'll find out today, is how she uses botanical medicine, traditional Chinese medicine and acupuncture, homeopathy, hydrotherapy, IV therapy, detoxification, nutritional counseling, and bioidentical hormones, amidst a lot of other more traditional ways of treating patients and people. Dr. Retz also focuses on treating chronic illnesses that so many of us are dealing with today. Her personal philosophy I wanted to share before passing this conversation over really stood out to me and touched my heart. I believe psychological healing begins when you feel listened to, cared for, and heard. I strive to provide the best bedside manner with my patients and to truly meet them where they are. So that is encapsulating Dr. Michelle Retz in a nutshell for now until we have this conversation begin. And I want to thank you so much for being here and sharing your gifts.
Thank you so much. I'm honored. Opportunity I get to represent our medicine and share my passion for, natural medicine is a wonderful gift. So thank you.
Yay.
Yay.
Well, I'd love to start in knowing what got you into this, like what got you into this path that you're on.
Well, I've wanted to be a doctor since I was 8. So my mom was an RN, and I was fascinated by the body just naturally. I'd read her RN magazines and look at the gory pictures, and I'd find her Grey's Anatomy, and I was just rifling through it in her closet. So I always had a natural curiosity about the body. And as I was growing up, I think I thought I was going to be like a surgeon, like a cardiothoracic surgeon. And I was fascinated. I wanted to, I'm fascinated by how the body works, and I only wanted to help put it back together. But when I think about truly my how and my why, I think is most related to my mother. She's a 1%er. And by that, I mean 1% of the things that never happened to anybody seem to repeatedly happen to her. So, random accidents or side effects of this or that, or pain issues. She's a chronic pain patient. She's had a lot of chronic severe illness. And I grew up with a chronic pain patient at home. So I understand from a patient's perspective what it looks like to live with seriously debilitating illness and what that looks like going through the traditional medical system. So even from a young age, 8, 9, going to doctor's appointments, pain clinics, surgeries, ER visits, you feel like you're on payroll, essentially. It's like rinse and repeat. She had a very complicated case, and I don't think most folks were checking that regularly when they saw her. It was just kind of like rinse and repeat, and we just didn't feel connected with. And I think that subconsciously started to filter in when I talk about bedside manner and the space you share with patients. This was all subconscious. I had no idea any of this was really happening until I got to college when I was at Ohio State. Don't hate me. But I was at Ohio State thinking, I'm going to med school. I'm going to be a surgeon, do all that. My junior year in college was really when insurance companies started to dictate the face of medicine and not compensate doctors. No, you can't run that MRI. No, we're not going to allow you to do that CT, or you're only getting a third back of what you're asking. And you started to see medicine change. Doctors needed to either see 40 to 60 patients a day. They were closing their doors. They couldn't pay their overhead. Something was different. And I was really nervous about entering our traditional medical field. I had friends who were graduating and getting into med school and getting out of med school who owed a ton of money and weren't really happy. And I was very nervous. Like, how much do I love what's happening here? And is there anything else available? And I hadn't heard of naturopathic medicine. There are practitioners in Ohio, but there's no school that's not licensed there. So I didn't know about it. So I found what's now called Sonoran University. It was Southwest College of Naturopathic Medicine. I was just one night in my apartment looking to see like what is available in the world. And I ran across the college and it was, medical school, traditional medical school, but then 4 years of acupuncture, Chinese medicine, homeopathy, herbs, nutrition, 4 years of nutrition, all the chelation, hydrotherapy, you name it. I'm doing half this stuff on myself anyway. And I jumped up and down for 20 minutes. I couldn't even believe it existed. And I was like, this is it. This is it. I, next weekend drove home to my parents and they were like, yeah, this sounds like you. And so they were very supportive. And that's how I actually, I moved out to Arizona before I was even accepted. I was so sure this is what I am here to do. And it's a good thing I got in. But that's how I came to naturopathic medicine.
What I get this a lot when I'm trying to explain to people. They're like, why would you go to a naturopathic doctor over a Western like general practitioner?
Yeah, I think, and I'll share, different perspectives of where my patients come from, but the approach for us is we're not inside the box. We're not a part of the traditional medical system. So we spend a lot of time with our patients. Naturopathic medicine seeks to harness the healing power of your body's ability to heal itself. There is infinite wisdom in us. We already know how to fight disease and heal. Something is preventing the body from doing so if acute or chronic illness has crept up. So we recognize that the body already knows how to do that. And we use, the least harmful, most gentle, natural, non-toxic substances to try to find the cause, the actual root cause of what's going on, not just address the symptoms that are popping up. Symptoms are our flashlights, our call signs, our warnings that something is going on, but they're part of a process. And so as traditional medicine may use different medications and therapies to address one symptom, and then another symptom may pop up as illness continues to go deeper in the body, it'll shift and change. Then we chase that symptom with this drug, then we chase that side effect with this drug, where we're not really getting underneath the issue, right? And addressing all of it. It requires someone to look at the 12 to 15 reasons why we are where we are in our life. We are not just a symptom, right? We have work and relationships, diet, sleep, exercise, stress, the environment we live in, all boundary issues, all of those things that are happening are contributing to how well we are able to regulate our health. And all of those need to be taken into the context of the individual that we're looking at. And that is never the same. There's no one protocol. There's no one size fits all, but it is required that we look at the wholeness of this person's life to understand what will be required to help treat them. One person with a stomach ache does not get the same treatment or the same workup necessarily even as another person, because those can manifest very differently. So the visits are often a lot longer, whereas a traditional medical doctor's visits, 30 to 60 minutes. Ours is 90 minutes at least. That includes a whole history, screening, physical exam, top to bottom. I'm gonna put hands on you, and looking at labs and imaging that's been done. I liked, I'm anal and thorough, this now, Michelle, but I like to look at who was watching you, what were they watching, what stones have been unturned and what haven't. Often, people have chronic illness, have their specialists, they've been everywhere, and pieces of the puzzle just aren't uncovered. So often I feel like my job is to is to look at not only what's been done and has it been, have they dotted their I's and crossed their T's with regard to that, but what else have they not been looking at? And then, I do have the ability to prescribe medication, but that's a toolbox over here. I mean, Mother Nature, I believe, does it best in our bodies. We come from the earth, so I like to use natural, non-toxic therapies if I can. I'm also very well educated, I suppose I would say, in drug, herb, and drug nutrient interactions. So if someone is looking to come off of a medication, and there are no rules to wean off of medications, we can have that conversation and we can wean them slowly off and use natural substances to support them in the way the medication was. If they are on medications and not feeling better, it's not working for them and they don't want to take it, we have natural options. If they are pregnant and they cannot take certain things, we have options that are safe for pregnancy. Homeopathy, Chinese medicine. I know which herbs are safe for pregnant mamas. If they have questions that their doctor cannot answer or doesn't have time for, I have time. I advocate my patients asking questions. I love that they research. This is a collaborative effort. We teach each other. It's not a top size, I say it, you do it. That's not my style at all. This is a collaborative effort. We are getting you well together. And I think, and I don't know, I'm not going to speak for every naturopath, but one strength of mine is that I am very good at helping patients flex around difficult scenarios, or if a pill doesn't work, how can we do that? If this time doesn't work, or I can't do all this or that, we'll figure it out. We will help it work for the patient. It's not a one size fits all. And I think people are they're just missing their connection. You call the doctor's office, you get the PA, you get the MP. You never get the physician. You never get the doctor. You can email me, you can call me. I will answer your questions. I will share space. I'm not charging you for every second I'm on the phone, but I really do care about the space we hold. And I think that part, that how well I get to know my patients. And then when I'm asking you how your mom's doing and did you recover from your dog's ankle getting broken, it's because that's your stress and your stress is my stress, right? I have to understand your life to understand how I can help you or how we can fix it together. It's just a much more intimate relationship. It's not a one size fits all. And there's lots of options on the table, whether it's integrated care that combines both traditional medicine and natural, or only natural, or helping come off, and transition one way to the other.
I love it. Is there anybody that you think wouldn't be appropriate for your work?
I think people have to be ready to be able to be empowered to take care of themselves. So, the paradigm shift between taking a pill a day that just gets rid of it, but really there's an underlying issue, like say blood pressure or a rash or, a heartburn or something, right? If the symptom is mass, I can go on and live my life. And they're like, that's cool. I'm good. But if I don't take the pill, I suffer. If it doesn't bother them that they have to take the pill every day, they're probably better off. If they're like, why do I have heartburn? How can I just get rid of this? What is it? Is it the pace of my life? Is it that I'm not making enough stomach acid? Is it that I've stressed and I don't have a gut lining anymore? I don't want to take this pill. I heard it causes stomach cancer. I heard it blocks iron and B12 and calcium and magnesium, and my gastro is going to take me off it in 3 months. So what am I going to do then? We haven't really gotten down to the issue. And so more folks who are interested in deeper health and healing, removing themselves from sort of needing medication or using the least, amount of medication that they possibly can, are best candidates for naturopathic medicine. This is not here's your pill, go on about your day. This is understanding what your illness is telling you about how you're living. Your symptoms are warning signs. Your body is brilliant and it works very well on its own. So when we're ill, something is off, right? And we need to honor that. So if someone is curious and wants to know more or wants a non-toxic approach, it takes me teaching you and then eventually handing the reins over to you. I want you to know if you have fatigue, is that thyroid? Is that adrenal? Is that your blood sugar's low? You haven't had enough water? You're sick? Which of those things does it look like so that 6 months from now, if it happens again, you know what it is and you know what to do about it. You don't need me. You know what it is, what it feels like. And oh yeah, I know what herbs to take. Now I know what to do with it. Oh yeah, I've had too much sugar this week or too much wine this week. I know what to do, but that's the goal, is to empower the patient to take care of themselves. So if they're not ready for that, they're probably not a good candidate.
Well, one of the things you use the word collaborative, that you're, that you don't always stand alone in terms of the work that you do, even though you're so comprehensive. And I think about, especially since we have Sarah on this call too, who works with eating disorders, as a dietitian out there. And so if I were to refer you to somebody in early recovery that's trying to, who's now, renourishing their body, or they've been post-treatment and they're just, wanting to get all their levels at par, is that something that you'd feel comfortable working with and collaborating? Even if Sarah referred you somebody, would
Oh,
you?
absolutely. I think, for me, and I love the psychology of illness. I think, and I'll get to your question, but we always start with the body where it's on fire, and then we work out to out here, right? It's always been out here with our thoughts and our boundaries and that energetic level. So when you refer someone to me, whether it's drug addiction or recovery from an eating disorder or whatever, there's always for me the what's the mental piece, because that's what we're left with, right? The addiction was to make us feel better from something. The eating was a method of control or release, or getting us, what's the psychology behind that? But we have to look at, okay, with our journey here in this eating issue, how has that treated the body? Has your thyroid been in stress? Are you anemic? Do you have nutrient deficiencies? How's your blood sugar? How has this affected your ability to make your own hormones? Because if we're dealing with malnutrition, we may not even have a high enough cholesterol to make all of our hormones. How are our adrenals? Because they've been stressed for the last year and a half trying to weather the storm. So very good at finding out nutrient deficiencies and how that shows up on paper, but also how that affects our endocrine system, our thyroid, our adrenals, our periods, all of that, as well as then for me, it's that mental emotional piece. And of course, it is a collaborative effort. It does require a village for sure. But, I'm always looking at the depression, the anxiety, the lack of resources they might have felt, the control. So I very much just have done a lot of that work myself, and I'm very comfortable addressing that as well, or working within, the context of who they're working with to help with homeopathy or Chinese medicine or herbs or Bach flower remedies or anything else that might help on that energetic level, to address that psychology piece too. But absolutely.
I know we when we initially talked, we also talked about folks in recovery from substance abuse, because I think you also work with ketamine, correct?
Ketamine, NAD, yeah. So, and in and outside of the space of substance abuse, I mean, I'd be careful with ketamine for recovery necessarily, but NAD is probably one of my favorite therapies for helping folks in acute withdrawal and recovery. And it really helps people navigate the cravings and the withdrawal symptoms, as well as repairs the damage that's happened to the mitochondria, the little energy powerhouses of the cell, which are highest in the brain, the heart, the kidneys, and the muscles. But the brain, we always worry about cognitive function, right? And how much happens with recovery. But if someone's really struggling acutely, NAD, which is nicotine adenine dinucleotide, it's a mouthful, is a molecule that's made in every cell in the body. And it's widely known for helping energy production, but it's also used for anti-aging. It's used for neuroregenerative issues. So if we have any neurological issues that have happened from a substance anyone's been on for however long, this helps repair the damage. It helps the brain produce more of its own serotonin. So when we have anxiety or depression, anything driving the actual addiction, as well as how deranged those chemicals can get during treatment, right? So it helps restore that so that when they're withdrawing, they don't feel that jolt in their neurotransmitters. And it really helps people feel really content, very calm, and it helps them stabilize. So when they're in therapy and they're working on changing their life and changing, that craving and that need, and they're working on having other tools, this really just helps them work with their providers to, in 7 to 14 days, they can be almost out of strong withdrawal. It is tremendous. It is just such a help. So that's an IV therapy that folks would come in and do once a week for about 4 weeks. Then you have them do it 1 month later, and then sort of just as needed if they felt like something was coming up where they were thinking about repeating the addiction. But that is extremely helpful. I think also you and I talked about MTHFR, which is a gene that helps with our folate metabolism. Folate's just a B vitamin. We use it in every enzyme in the body, but it has a particular affinity for our brain chemistry, how we make serotonin, dopamine, epinephrine, norepinephrine, all of that. And as that may be related to the issues behind the addiction or how well they can recover, because if that gene doesn't work, they're going to be deficient in those nutrients. And all you need to know is they don't make the right type of folate. And if you give them the right type of folate on the other end, then they can go on and make their own neurotransmitters better. So that's a simple blood test. It's not an expensive genetic test, but it's a simple blood test that I would also, I just want people to be aware about, because you can get that from your provider. You know, it's a very simple blood test, but if you don't make enough folate, they're going to struggle coming out of that. So that could be really helpful. It's a very simple thing. Ketamine, also very well known for, it's a increasing BDNF, brain-derived neurotropic growth factor, which means it helps our nervous system build new nervous tissue. You actually build new neurons in your brain and in your spine. So ketamine has been very well known for pain. It's used, it's been used since the 30s as an anesthesia, but in very low doses, it can help with it's been used for chronic pain, joint pain, rheumatoid arthritis, TMJ, migraines, I mean, any and everything, because it helps the body regulate its own endorphins better, because you're building new nerves that actually don't have that chronic pain signal happening. In terms of mental health, whether it's addiction or eating disorders, and there's been a lot of good studies for it on anxiety, depression, bipolar, PTSD, trauma, significant benefit, especially in folks where antidepressants, people have tried 6 to 12 medications and none of them are helping. Whether it's for anxiety or depression, whatever's going on with their brain chemistry just does not work with medication. This is where ketamine is particularly helpful, because we're building new nerves that are working on their own. So it's fascinating. So not only are you using something instead of medication, but over time, their body is going to regulate itself better and they're not going to need it. So it's almost like, you see that you do a therapy short term, maybe once a week or something initially, or once a month, depending on how severe the symptoms are. And then over time, as their brains and nerves develop, they don't need it as much. They're regulating themselves, they're healthy, they're happy, and they're not using anything, which is tremendous. So there's a lot of good research on ketamine for all of those concerns, and often they go together. Depression hurts, anxiety can hurt, chronic pain causes chronic mental issues. So that is a really helpful, we use it as an IV, or we can use it as an oral therapy as well. Really helpful for both of those spaces.
It's awesome.
It really is. I can't even tell you. And I mean, when folks come in, they have to see a wellness provider to be able to receive the treatment. We're very careful about how we vet patients and make sure we know if they're on medication, we're monitoring that, or there's things they're not going to do the day of treatment. We have to watch their blood pressure. We have to make sure they don't have any, other symptoms. They haven't had a concern with anesthesia before. So, I mean, we're really careful, and I'm on site during every IV if they're doing an IV treatment. And we offer that with Reiki as well. So we can have that mental, emotional, energetic piece, but I'm still there when anyone has a treatment, just in case anybody, we're very careful about how we do it. We're not like leaving people on a bed somewhere in the closet, just dripping by themselves. So we're there. I'm always around.
Yeah, because I think ketamine, obviously recently too, with some of the media hype, and there's so many different ketamine doctors out there that are just kind of taking advantage of people.
It's too easy to do it unethically. And I see a lot of these patients where they are slamming them with doses they do not need. With ketamine, more is not more therapeutic. You want a treatment would make you feel like you had a glass of wine. That's it. You don't need to have a hallucinatory, dissociative experience for that to be therapeutic for you to get relief. And, I am having patients who have had been doped up for like 2 days after their treatment. I was like, it doesn't require that at all. And I caution patients because they do tend to feel more of that relaxed effect in the beginning. And I tell them, where you are and where the medicine is, the energetics, that very different, right? And so the contrast will be felt the most. And as you start to self-regulate and the body starts to heal, you're going to feel the treatment less because you're better. So don't expect that every time. That doesn't mean it's not working, but that's not the goal, is that you don't have to feel it for it to be working, which is also, there's a weight range that we use, like milligrams per kilogram. time. We're very careful just again to stay in a safe range and have a range for people to know where they are. And I tell them where their range is too. And I said, you were way outside of your range. That was not medically ethical, so we try to be as careful as we can. And we work with counselors who do ketamine assisted psychotherapy as well. So I'll be there, I'll prescribe for them. So patients will come in and we'll give the interview and say, yes, they are cleared, or no, I don't think it's going to be beneficial, or I've warned them not to take this and that the day of treatment, just so they make sure that they're getting a doctor on the other end overseeing their treatment, which I think also just helps everybody feel better.
I think we talked a little bit about this too, about you being able to see people in different states. Is that correct? You can
Absolutely. I have patients all over the US and Europe and Canada, Mexico. Absolutely. So while I love to share space with people, they move, or, sometimes it's like, hey, my mom's in New York. Can she see you? Absolutely. It's the same process. There's just no physical exam. And I say, hey, if you're ever able to get to me, please do come in, because I want to put my hands on you, so to speak, so I can make sure I do the best medicine I possibly can. But I'm happy to see people everywhere. We still do an hour and a half telehealth visit where I'm going through every single, that questionnaire is still going to exist. Go through all the details and all their labs and imaging. I'll have them send them to me, and then I'll either, create half the treatment plan that day and wait on if there's any other labs or imaging that we need to put the whole thing together. And our visits will be telehealth after that. But absolutely, there's no reason. I just don't want to restrict my medicine from anyone if they want it. So however they can get to me, I am happy to help them.
Can you share a little bit about what it looks like from like the beginning to the end of being able to see you for the first time? Because it's a little bit different than a traditional doctor's.
Sure. So if anybody, oftentimes they just want to know what that looks like. So we do a 15-minute phone consult. Some people do, some people don't. But if they have questions or they want to know what my approach would be, or if they've already seen some other practitioners, they can pay $25. We'll have a 15-minute phone consult where I ask them what their concerns are, ask them what treatments they've received, did they do this or that testing, so I can help them navigate my thought process about their concern and where I would go, and if that seems like it's a good fit or not. I think it's really nice to be able to talk to a provider and go, yeah, we totally resonated together. Or like, I liked her ideas. No one's done this. No one's done that. She told me to get this and that and send me your labs. And they already know that what I'm thinking about ahead of time. And so then we don't require any payment up front. We really just like to send the health questionnaire, which is like 30 pages, probably 15 of that are your actual health history. It's very detailed, from who you are, what your concerns are, what symptoms you've had, what symptoms you have now, what toxic exposure you've had. I mean, what's your family history? It's very thorough. We do a 3-day diet diary where we want to know what you're eating, how you're moving, how you're sleeping, all those things. And then you return that to us. You just email that back to us. And as soon as you do, that allows you to book the appointment. So then you'll book the appointment with me for 90 minutes. All my new patient visits are 90 minutes. And either it'll be telehealth or in person. If you're in person, that's, like I said, going to include a physical exam. That first visit is for $25. I will, depending on the concern, I often will try to initiate general natural medicine the day of treatment if I feel like there's something I can do to get you feeling better, not palliatively, but that I know that's still going to work while I'm looking for other causes that might have been missed. So I may recommend herbs or something in the moment for mental, emotional, support while we're waiting the 2 or 3 weeks it might take to get the labs back. That could be specialty testing like stool test or heavy metal testing or toxin testing or just basic labs. And we work with LabCorp and Quest and labs anywhere all over the nation. So we can make that pretty easy for folks. LabCorp and Quest diagnostics are all over the nation. So that's pretty easy. And then we'll have a follow-up visit. That's an hour. That's $300. And that's where we'll go over I'll check up on symptoms. If we started treatment, how have you been doing since I saw you in the last few weeks? What's come up? We'll go over the labs. We'll create a whole treatment plan that includes diet, any additional support that's needed based on what came up. If we have to kill an infection or detox someone or treat the hormone deficiencies, whatever that is. We talk about lifestyle, exercise, and then labs we need to follow up on. And I think I'm pretty good. You let me know, Michelle, on helping patients know my next step, what my thoughts are. If not this, then that. I always want them to know what I'm thinking. One, I think that helps them feel like I'm capable. And I think it's nice to know, like, what's the process? What's the plan? Or here's when we check this, and here's why. But I also give them, an email and phone number where they can reach out to me in between visits so that if they need to, they can. And everybody laughs because they're like, yeah, but I genuinely mean it. I don't want something hanging over your head in the background, creating anxiety or worry. If I can talk to you, or if you're really struggling with a food or a symptom or a die-off reaction or something, I want to help ease that as quickly as possible, right? So it takes a minute for people to realize, like, you can, and I encourage you to reach out to me. This is a relationship. This isn't like a one and done. And then all my visits after that are about 45 minutes. And those are $275. Depending on the nature of what we're treating, I may see you back within 6 to 12 weeks after that initial visit. And then my goal is to see you less and less, meaning you're getting better, you're educated on how to take care of yourself. But I do like to check in with my patients about every 6 months just to make sure I know how they're doing. A lot of life happens in 6 months to a year. So whereas most docs just want to see their patients once a year, I do like to check in with folks twice a year.
Yeah, I mean, I think one of the things you're pointing out, what I love about naturopathic medicine is it's empowering, right? So instead of going to like a normal GP, where they typically will band-aid, you're actually learning about the roots of why the symptom's happening, so that yes, you might temporarily put a band-aid because the symptoms are so bad, but that you're going to get to the root so that it doesn't keep volcanoing.
Yeah, there's a lot of education, and I think that's really empowering, and people want to know, how did this happen? How did I get here? How do I let this never happen again, right? Or how is my life really, I really do need to, this job is affecting my health. This thing with my sister is really screwing me up. Look at it. There it is on paper right there. I mean, there's nothing that's off limits, right? And I mean, we get very personal because I am going to talk to you about your boundaries with your partners and your children and your job, because fundamentally, these are all the things, the big things in the background that, affect our day to day. And so it is collaborative. And then there's lots of education with diet and lifestyle or breathing or sleeping hygiene. And, just there's lots that we're here to teach each other, right? So they teach me as much as I teach them. But yeah, the goal is that you walk away learning so much more about you and how your health has been affected and what we're doing and why we're doing it. You have to know the why, because I mean, you may be taking some supplements for a couple months or something, and you've got to understand in the background what we're chipping away at and what each thing is doing to understand why we're using it. But people love that.
I mean, it ultimately is a little bit more work because there's supplements or there's change of diets or lifestyle that could be integrated, right? Because I mean,
always should be, in my opinion.
You can't eliminate stress. Like, we're going to all have our different life experiences, and it's all going to affect our bodies in different way. And it's good to know, like, you know what, I'm going through the grief of, my father passing. Like, I can't eliminate that. And so my body's going to digest it a certain way. But if I know, like, okay, typically when this happens, I get these symptoms, I'm going to nourish my body with extra supplementation or whatever, you're better off.
To go, hey, you know what? It's okay. You're not hungry when you're grieving. And yeah, you're kind of mean, and that's all right. Here's a remedy for that. Here's a homeopathic remedy, but that's normal. Like, right. To just be like, give yourself some grace. We're so hard on ourselves. Our culture does not allow us to take a beat to lick our wounds. Get up, keep going, push through, you pansy, I mean, what's wrong with you? Why couldn't you juggle those 5 balls on a broken foot? Like, what's wrong with you? Right. So, when someone's like, hey, pause. It's okay to sit down. It's okay to feel your feelings. It's okay to cry. It's okay to not be hungry. It's okay to put the covers over your head for a minute, and then we come out and I'm going to give you some tools. We're going to talk about it. I think you just need tools. Feels good to take action in whatever way. We don't want to be a victim, and we don't want life to just happen to us. And one style of medicine allows you to take a pill and just passively, you're not dealing with anything, right? Like, physical symptoms are a manifestation of something energetic somewhere down the line, always. We start with the body and then we work on that mental, emotional piece if you're willing to, but we're going to talk about it. So there's lots of, we just help help on that level. I think that has to be addressed and it has to be integrated to the level of comfort and ability and more practical. Like you can't divorce someone tomorrow. You can't leave your job tomorrow. I realize that. However, can we start looking? Can we start dreaming about what it would feel like to be in an environment that's positive and supportive, to be on your own, or whatever it is that person needs to feel healthy in a body that's strong and doesn't hurt, and to feel good, to have energy to do the things you need to do. So wherever they're able to go, I'm going to meet them. And that's that we walk together piece. There's no judgment. People come in and they're like, you're going to hate me. I couldn't do it. Or I had chocolate. I'm like, I don't hate, you're a human. I get it. Nothing is black and white ever. It's always gray. Let's just give ourselves some grace, meet us where we are, and let's go forward. How do we go from here? How do we do it there's no judgment. I don't work that way with my patients, and I'm never going to fire a patient, and I'm never going to chastise them. That's just not my style. Some people need that, and they'll find those doctors that do that. That's just not my style. I work with the messy, and it's always messy, and that's okay. It's okay. We're all messy. And that's all right. We don't need to feel bad about it. It doesn't help us feel, you just need somebody to love you and help you move forward.
Sarah, Darcy, do you guys have any questions that you want to ask?
I first just wanted to say I hear a lot of informed consent, and I am so thrilled to hear that. You're keeping them informed the entire way so that they feel like they know why. Because oftentimes I'll ask my patients when they come in, so why did your doctor put you on this medication? Or what is the intent of this one? And they're like, I just took it. I just took it. And I'm also a clinical RD who works in the hospital, and I see them come through the emergency department. I'm like, so I see you're on like this medication, and what was it? They don't know. They just like a robot will take it sometimes. And so I hear a very collaborative approach and lots of informed consent. So just thrilled to hear that.
Thank you. At the best level that it could be, it's showing that they trust their doctor, right? If they trust their doctor enough to take the medicine, at least they believe that what they're doing will help, and then there's the result of whether it is or not. But at least it shows trust. But I think we're way more capable, and I think medicine and health have a lot more to offer. And we're not here to just sit idly by and let things happen to us. I mean, that's not the human experience, I think, right? In my opinion, anyway.
My question to you is going to be, do you screen for eating disorders? Like if I get anyone who comes to me, be it for diabetes, high blood pressure, it doesn't matter why they're seeing me, for what medical nutrition therapy they're seeing me for, I'm gonna screen them. And that's our first question. But do you do anything like that?
I think our health questionnaire starts to address that, whether there's either a history of overeating or binging or restricting. There's no eating disorder questionnaire necessarily for that, but I always am asking about eating habits. We're doing a food diary. I ask them about cravings, about late night eating, restricting, binging, purging. I mean, so I'm asking everybody those questions, but I don't use a specific questionnaire necessarily.
Yeah, you're not afraid to go there. I'm pleased to hear it.
Well, no, because that's quite common.
The one I use is the Eat 26. And what I say to them is just as someone is screened for malnutrition when they come to the hospital, it's just 4 simple questions. We screen for eating disorders, and I'm not the one to diagnose, but it indicates to me that a referral may be needed. And usually, I mean, they know once they fill out a questionnaire, if they're scoring high, they're probably going to be getting a referral. And I find people are usually pretty honest and transparent about it. So it's a tool I found really useful, but I'm pleased to hear that you have a lot of those very similar questions on your own questionnaire too.
Yeah, thank you for sharing that.
I have so many questions that I'm going to
ask them all.
So many. Thank you. I hear your heart and dedication to really meeting people where they are. And like Sarah said, in the chat about shame is a poor motivator too. And I was thinking about how much shame can either propel people to just give over their power and decision making to people who have education, or avoid getting support. And with that, I'm wondering how you meet people, or what you wouldn't say to anybody who's feeling hesitant to approach a new way of treating themselves, talking about medicine in a different way versus going to their doctor, calling the pharmacy, and just having the same old happen. Are there any words of encouragement or maybe validation around any feelings or fear or not knowing how to get started?
I think we even start to broach that topic on our questionnaire of like, how ready are you? What kind of support do you have? How supportive do you think your family will be to you going through this? Are you ready to change your diet? Are you ready to change your lifestyle? Are you ready to maybe take some supplements? Are you ready to look at the medication? We ask those questions and have them rate their readiness so that before I even meet this person, I have an idea and I want them to have an idea of how ready they are as well. So I think my job is to present all the options and talk about what my opinion might be from their health point and how severe or mild that is, what I might offer or think is most appropriate, whether that's natural, integrated, or just traditional medicine, and give them all the options and then talk about what seems most reasonable to them. I'm always paying attention to their wallet. I'm always paying attention to how many pills a day that looks like. And we're talking about side effects, whether it's an herb, a medication, whatever. You can react to anything. And so it is never a one size fits all. We've had conversations about natural support for thyroid versus actual thyroid hormone, or Vitex chase tree berry versus progesterone support, or needing an antibiotic versus using a natural antibiotic, what it looks like, how severe this is, how it might affect you. Cost-wise, what does this look like? It's $10 from your pharmacy versus it's $40 for a supplement. You have to take 4 pills a day. Like, I get it. And even though I love natural medicine, like there's a person there that either loves to take stuff, doesn't do well with pills, hates the taste as a texture thing. That's everybody. This is not a one size fits all. So there's no one answer. I will work with anybody and meet them where they are. It's just a matter of knowing what your options are. Again, it's like empowering the patient. You can't make a decision as a patient with any doctor until you really, you can, if you just to say, I'll take whatever you want, but I want to empower you to know what all of your real options are, to know what that looks like financially, to know what it looks like on a day-to-day, what that will feel like in your body, and taking those pills or those herbs or whatever. And you're like, yeah, I'm not doing that. It's like, okay, cool, that's fine. We'll take this. But if you're going to take that, then I just need to watch your B12, or we're going to need to, I will integrate there's no judgment. Really, I got to meet people where they are. If we can get them feeling better, and the space we share, I think is really important, because my biggest thing is creating trust and rapport with a patient. And so I don't have a lot of that, because I think that they can feel my empathy, and I'm holding their hand. I'll cry with them. I will cuss with them if they need to throw the pillows in the room, like whatever they need, that's their space. So I think my office is often one of the few times they get to let down or be vulnerable. And I think by the end of the first visit, usually they have a pretty good feeling, because I've explained what's available. I've explained my thoughts, what our process is going to look like, all the things I'm thinking about, which we may not address right now. I go, that's over here. This is not something, but I want you to know I'm thinking about it. We've got to talk about your mom later, right? So I don't know. I don't come up against that very much, but I would just encourage, I understand you have a right to feel hesitant. You have a right to feel fearful and skeptical. Our system is not doing a good job of building you up and nurturing you and helping you stand on your own 2 feet. And that is my intent. That is my intent, in whatever way looks and feels good for you. There's no one answer. You can tell me no. You can tell me that's ridiculous. You're not going to hurt my feelings. I will figure it out. We'll figure it out together, right? But there's not one answer for everyone. So I would ask you to give me a chance, or give this type of medicine a chance. It's a lot closer. We're going to know each other very well. You're going to know things about me, probably, that you didn't even think you should know about a doctor. But a good doctor is a good patient. They've done the work on themselves. I won't recommend anything to anybody I haven't done. And that's enemas and colonics and peptides and you name it, honey. I won't recommend anything I haven't done. So I can walk a mile, so I can tell you what to expect. And I can tell you how great or uncomfortable or short-lived something is. And I think that they feel that from me. So I know very much what I'm talking about, because I've done it. And I won't recommend something to patients I haven't done myself. Does that help?
So much. And I have so many questions, so I'll contact you individually.
No
We'll turn
problem.
this into my intake. Thank
Of
you.
course.
The way
Yes.
you invite conversation and the normalizing of it's okay to be where you are and it's okay to talk about it. And we can talk about it at the pace that you're open to it. And that just really, it's a very different way for me to think about medicine. And I like it. So thank you.
Well, thank my mother's doctors because they were the ones who subconsciously put that in my head too. So, yes, thank you.
And Sarah had some questions about SIBO testing and treat if you offer SIBO testing and treatment, and
Sure.
you are permitted to prescribe antibiotics.
Absolutely. I taught gastroenterology at the medical school that I attended for 7 years. So GI health is just like a serious passion of mine. Everything from here to here. But SIBO, small intestine bowel overgrowth, absolutely. We test for it. We do the lactulose breath test by Trio Smart, which will check for methane, hydrogen, and hydrogen sulfide gases. And yes, we can prescribe. And yes, we do offer natural antibiotic treatments. Treatment does not just include killing the infection. That's the first part. But then we spend 3 months after that healing the lining, working on motility and peristalsis and any underlying causes as to why it happened. Was their ileocecal valve open? Is there gastroparesis or a motility disorder? Are they making enough stomach acid? So we're also looking at all the other things behind why they got the SIBO. And stool test. I do a ton. Yeah, GI is like, so yes, I love treating the gut.
Thank you.
Mhm.
I'm glad now that, regular primary care providers do recognize things like SIBO now, and they will prescribe something like Xifaxan. But the lack of follow-up, I'm really concerned about.
You
And
must
those,
retest. You
yes,
have
and
to
did they
retest.
retest? And they can't. They're like, no, I've been referred to a GI, and I go, okay, can you maybe ask for retesting first, with your GI? And in the meantime, we're going to try this, and that. But I'd love to have someone to pair with on that in
For
between,
sure.
so that they don't feel like they have to see a specialist, which is fine.
Yeah.
But if they're like, hey, like, that's going to be, and then I see a lot of them see specialists, and then they feel not feeling very validated
Oh,
either.
and to be fair,
Um,
they don't follow up. You see the specialists even less. So they never repeat the breath test. You've got to repeat the breath test within 5 days of finishing the treatment to know if you're ready for the next step or not. Because if you're not, you don't pass go. You don't start working on any of that stuff because they get all gassy and bloaty, anything you put in their tummy, right? So you have to retest. And then yeah, they're not trained on. There's no healing. There's no motility. There's none of that. Like how do we get here? So that's the part I see missed as well, quite a bit. Yeah.
And as their dietitian, I can support them through that a little bit.
Yeah.
But they need to see someone that's very familiar with this, can do the retesting and so
Oh
forth.
yeah.
So pleased to hear that you do those things. Thank you.
Uh-huh. What else?
I muted myself because I want to make sure
No worries.
I just keep talking while nobody can hear me. Um, I feel like we could spend hours on this. I'm just glad that we got this opportunity with you, Dr. Retz, and we'll
My
be,
pleasure.
your contact information. We'll be able to put that up on the website, which should be on this week, which is exciting for people to get to know you more. And I love that you can go national, maybe even international. I've got some folks in the UK now,
Yeah, good.
which would be really fun.
Yeah.
Have as much of that in Europe.
They're so open to it and they're so good in Europe. There's so much stricter standards just for food and in Europe in general. So I think people in Europe are way more open to naturopathic medicine, much more aligned, I would say. Yeah.
And then as far as referrals, like from professionals like Sarah or myself, do you prefer the referrals to go through email, like just from an introduction, like, hey, we're referring Sally, just wondering
Sure.
that.
Absolutely. I mean, and I'm happy to give you my contact information outside of this meeting as well, if that's easier. But email's always great just to get if there's, it's definitely a history with someone you want me to know and just things so we can be in response before and during or after. Absolutely. That works great.
That's a good question, Sarah, because yeah, you don't have to start fresh when you've had when there's been a professional involved for like, months.
Yes.
That's great.
Absolutely.
Okay. Well, thank you again for your time.
My pleasure. Thank you for yours and just for highlighting, the real passion that I get to do every day. I'm very blessed. And it's always nice to extend our network, right? We're all here we're all going to be helping together. We're all here for the benefit of the patient. So we're so lucky to know each other and then be able to build on that for our patients' good, right?
Mhm. Absolutely. Yay.